Welcome to the CPR and AED class for adults, children, and infants. The American Red Cross defines infants as anyone 2 or younger, children 2 to 12 or puberty age, and adults 12 and older. This class will be a combination of online lecture and video lessons, then in-person hands-on practice and examination. When scheduled, everyone will come into the office to do hands-on practicing with the mannequins and complete a final hands-on exam, where you will demonstrate correct techniques for CPR and AED use. Everyone will then be required to complete a written test. Those who pass the checkoffs and score a 75% or higher on the exam will be CPR and AED certified. The primary purpose of the American Red Cross CPR AED program is to help participants recognize and respond appropriately to cardiac and breathing emergencies. This class will teach participants the knowledge and skills needed to give immediate care to an injured or ill person and to decide whether advanced medical care is needed. The American Red Cross uses the cardiac chain of survival as their guide to help save a person's life during an emergency. As we progress through this class today, we will look at and learn to utilize the first 3 steps to help save a person's life. Now, let's watch a video on the cardiac chain of survival.
When a person is in cardiac arrest, quick action is crucial. The cardiac chain of survival describes 5 actions that, when taken, increase a person's likelihood of surviving cardiac arrest. You have a major role in completing the first 3 actions. There is a cardiac chain of survival for adults and one for children and infants. Let's look at the adult cardiac chain of survival first. The first link in the cardiac chain of survival for adults is recognition of cardiac arrest and activation of the Emergency Medical Services (EMS) system. The sooner you recognize that a person is in cardiac arrest and call 911 or the designated emergency number, the sooner advanced medical personnel will arrive. Early CPR is the second link. CPR helps to circulate oxygen-containing blood to the brain and other vital organs, helping to prevent brain damage and death. The third link is early defibrillation. The electrical shock delivered by an AED may restore an effective heart rhythm, significantly increasing the person's chances for survival. The fourth link is early advanced life support, which is provided by EMS personnel at the scene and on the way to the hospital. Integrated post-cardiac arrest care is the final link. After the person is resuscitated, an interdisciplinary team of medical professionals works to stabilize the person's medical condition, minimize complications, and diagnose and treat the underlying cause of the cardiac arrest. The pediatric cardiac chain of survival is slightly different from the adult cardiac chain of survival. Because cardiac arrest in children often occurs as the result of a preventable injury, such as trauma, drowning, choking, or electrocution, prevention is the first link in the pediatric cardiac chain of survival. The second link is early CPR, and the third link is activation of the EMS system. Just as in the cardiac chain of survival for adults, the fourth and fifth links are early advanced life support and integrated post-cardiac arrest care. 4 out of every 5 cardiac arrests in the United States occur outside of the hospital. When you complete the first 3 links in the cardiac chain of survival, recognizing cardiac arrest and activating the EMS system, immediately beginning CPR, and using an AED as soon as possible, you can make the difference between life and death for an adult, child, or infant in cardiac arrest.
The first step in the adult cardiac chain of survival is recognizing an emergency and activating the EMS service. In order to do this, you must be able to recognize when there is an emergency situation and decide to act on it. First, we will talk about different illnesses that could cause an emergency. Then we will discuss how to act first in the situation. So we first need to understand that CPR stands for cardiopulmonary resuscitation, meaning we are essentially pumping the heart and breathing for a patient. We need to utilize CPR during cardiac or breathing emergencies when the patient becomes non-responsive. Both cardiac and breathing emergencies can eventually lead to something called cardiac arrest. Cardiac arrest means the heart has either stopped completely or it is pumping at such an irregular rhythm, blood is not being adequately supplied to the body. Remember, your blood carries oxygen to all your organs, and your heart pumps the blood to those organs. If your heart isn't pumping or isn't pumping effectively, blood and oxygen won't reach your organs like your brain, and they could eventually die. Cardiac arrest happens suddenly, without any signs and symptoms. Cardiac arrest can occur as a result of cardiovascular disease, breathing emergencies such as drowning and choking, severe trauma, electric shock, and drug overdose. In children and infants, the most common causes of cardiac arrest are breathing emergencies, chest trauma, and congenital heart disease. Although a heart attack can lead to cardiac arrest, the two conditions are different. A person in cardiac arrest is not responsive, not breathing, and has no heartbeat. In the next video, we are going to see signs and symptoms of a heart attack. A heart attack occurs when blood flow to part of the heart muscle is blocked. For example, as a result of coronary artery disease. Because the cells in the area are not receiving the oxygen and nutrients they need, they die, causing permanent damage to the heart muscle. Seeking advanced medical care as soon as the signs and symptoms of a heart attack are recognized can minimize damage to the heart and may save a person's life.
Being able to recognize when a person is having a heart attack can be a life-saving skill. Signs and symptoms of a heart attack vary from person to person and can be different in women than they are in men. Even people who have had a heart attack before may not have the same signs and symptoms with a second heart attack. Chest pain, pressure, and discomfort are the classic signs.
So let's recap the key points. Individuals may experience heart attack signs and symptoms differently, and not everyone will have every sign or symptom. Even people who have had heart attacks before may not experience the same symptoms or signs if they have a second heart attack. While men often have the classic signs and symptoms of a heart attack, such as chest pain that radiates down one arm, women often have more subtle signs and symptoms. In women, chest pain or discomfort may be milder and or accompanied by more general signs and symptoms, such as shortness of breath, nausea or vomiting, extreme fatigue, and dizziness or lightheadedness. Because these signs and symptoms are so general and nonspecific, women may experience them for hours, days, or even weeks leading up to the heart attack, but dismiss them as nothing out of the ordinary. Signs and symptoms of a heart attack may also be more subtle in people with certain medical conditions, such as diabetes. Many people who are experiencing the signs and symptoms of a heart attack wait too long to get advanced medical care. It is important to call 911 or the designated emergency phone number immediately if you think that someone is having signs and symptoms of a heart attack. There are 4 actions they can take to make a difference in the outcome for the injured or ill person. These actions are recognizing that an emergency exists, deciding to take action, activating the Emergency Medical Services (EMS) system, giving care consistent with their knowledge and training until EMS personnel arrive and take over. Before giving care, always obtain consent. To obtain consent, tell the person who you are, what type and level of training you have, what you think is wrong, and what you plan to do. Then ask the person for permission to give care. When the person in need of care is a minor, obtain consent from his or her parent or guardian if one is present. Consent is implied when a person is unresponsive, confused, or mentally impaired, or if the person is a minor with a life-threatening condition and the person's parent or guardian is not present. If a person is awake and alert but does not give consent, do not give care. If you think that the person has a life-threatening injury or illness and needs help, call EMS personnel. After obtaining consent, you should give care to an injured or ill person until another trained responder. If you are alone with an injured or ill person and there is no one to send to call for help, you need to decide whether to call first or care first. Call first situations are likely to be cardiac emergencies. When a person is in cardiac arrest, the priority is getting help on the scene as soon as possible because early access to EMS and an AED increases the person's chances of survival. Call 911 or the designated emergency number first for any person above 12 years or older who is unresponsive, a child or an infant who you saw suddenly collapse, an unresponsive child or infant who is known to have heart problems. Care first situations include breathing emergencies and life-threatening bleeding. In these situations, there are immediate actions that you can take at the scene that may prevent the person's condition from worsening. Give immediate care and then call 911 or the designated emergency number for an unresponsive infant or child younger than 12 years old who you did not see collapse, a person who is choking, a person who is experiencing a severe allergic reaction, anaphylaxis, and has an epinephrine auto-injector, a person who has severe life-threatening bleeding. Next, we are going to watch a video that explains the check, call, care system. Before rushing to help an injured or ill person, size up the scene and form an initial impression. So the first thing you do when you arrive is size up the scene. Use your senses to gather information that will help you determine whether the scene is safe for you to enter, what happened to cause the emergency, how many people are involved, what condition the person is in, and whether anyone else is available to help. Part of doing the scene size up is forming an initial impression about what is wrong with the person. For example, does the person appear ill or have any immediately identifiable injuries? Is the person moving or motionless? Does the person have signs of a life-threatening illness or injury, such as trouble breathing or severe life-threatening bleeding? The information you gather when you are sizing up the scene and forming an initial impression will help you determine your immediate next course of action. Depending on what you observe, you may need to call 911 or the designated emergency number, obtain equipment such as an AED and first aid kit, provide immediate care for a life-threatening injury or illness. For example, if you see severe life-threatening bleeding, you should use the resources available to you to control the bleeding right away.
Now that you have recognized an emergency and decided to take action, follow the emergency action steps. Check, call, care. Before rushing to help an injured or ill person, you need to check the scene, so stop, and look around. By answering the following questions, you will gain the information you need to proceed. Is the scene safe to enter? Hazards such as fire, spilled chemicals, and traffic, to name a few, could endanger you or any bystanders. If the scene looks unsafe, stay clear and call 911 or the designated emergency number. What happened? Check for clues that might tell you the cause of the emergency. How many people are involved? In an emergency with more than one injured or ill person, you may need to prioritize care. What is going on with the person? Form an initial impression about the nature of the person's illness or injury. If you see severe life-threatening bleeding, take action to control the bleeding using any available resources. Is anyone else available to help? Bystanders may be able to provide valuable information about the situation or the person, along with getting needed items, controlling crowds, and reassuring the injured or ill person. Once you've checked the scene, you need to check the person. If you are not sure whether a person is unresponsive, shout using the person's name if you know it. If there is no response, tap the shoulder for an adult or child, or the bottom of the foot for an infant, and shout again while checking for normal breathing. Check for responsiveness and breathing for no more than 5 to 10 seconds. If there is no response and the person is not breathing or is only gasping, the person needs help right away. This brings us to the second emergency action step: call. Unresponsiveness, trouble breathing, and severe bleeding are all signs of a life-threatening emergency. If your initial check reveals these or any other life-threatening conditions, make sure that someone calls 911 or the designated emergency number right away. The final emergency action step is to give care according to the conditions that you find and your level of knowledge and training. Always remember, check, call, care, and you'll be ready to respond to any emergency.
Now that we know how to recognize an emergency and when to call 911, we are now moving on to the second link in the cardiac chain of survival. The second link is quality CPR. CPR stands for cardiopulmonary resuscitation. Cardio for heart, pulmonary for lungs, resuscitate, bring back to life. CPR consists of alternating between doing 30 chest compressions and 2 breaths. For CPR, an adult and child will use the same technique, while an infant CPR will vary slightly. You must use your best judgment when deciding if a toddler is an infant or a child. First, let's start with an adult and/or child. As you get into position, remember the following things. Position yourself on the side of the patient. Your hands should be placed in the center of the chest along the breastbone. I strongly recommend putting your dominant hand on the bottom and linking your non-dominant hand on top. Make sure when you go to do your compressions, your arms are straight over the patient's chest. Remember, for an adult or child, we are going to be doing 30 compressions, 2 inches deep, at a fast rate of 100 to 120 beats per minute. This will get tiring very fast. If your arms are straight over the patient's chest, you can use your own body weight to help give compressions. After giving the patient 30 compressions, you want to tilt the head back to open the airway. If you do not tilt the head back, the lungs will not inflate on a real person. To tilt the head back, place 2 fingers under the patient's chin and push up. Your other hand will need to plug the nose before you give rescue breaths. An effective rescue breath should be about 1 second long, smooth, and consistent. Next, we'll watch the video to see how CPR is performed.
Hey, are you okay?
After confirming that someone is unresponsive and not breathing or only gasping, assume cardiac arrest and begin CPR.
He's unresponsive. Go
Ensure the person is on his back on a firm, flat surface such as the ground. Next, kneel beside him and place the heel of one hand in the center of his chest, with your other hand on top. Interlace your fingers and make sure they are up off the chest. Position your body so that your shoulders are directly over your hands. With this technique, you can use your body weight to help compress the chest. Now, give 30 chest compressions. Keeping your arms straight, push down at least 2 inches, then let the chest return to its normal position. Continue to push hard and fast, giving compressions at a rate of between 100 and 120 compressions per minute. For a child, push down about 2 inches, and for a smaller child, you may only need to perform chest compressions with one hand. Next, give 2 rescue breaths. First, place a breathing barrier over the person's nose and mouth. Then, open the airway by putting one hand on the forehead and 2 fingers on the bony part of the chin and tilting the head back to a past-neutral position. For a child, you'll only need to tilt the head to a slightly past-neutral position. Pinch the nose shut, take a normal breath, and make a complete seal over the person's mouth with your mouth. Blow for about 1 second while looking to see that the chest rises. Take another breath, make a seal, and give a second rescue breath.
1 and 2 and 3 and 4.
Continue giving sets of 30 chest compressions and 2 rescue breaths until you notice an obvious sign of life. An AED is ready to use and no other trained responders are available. You have performed 5 sets of CPR and another trained responder is available to switch.
1 and 2 and 3 and 4 and 5 and 6.
You have performed 5 sets of CPR on a child. You are alone and need to call 911.
17, 18, 19, 20, 21, 22, 23, 24.
EMS personnel take over.
28, 29, 30.
You are alone and too tired to continue. Or the scene becomes unsafe.
1 and 2
Have
and
the
3
AED
and
and
4
first aid
and
kit.
5.
Now let's watch how CPR on an infant is performed.
When you're the only provider initiating CPR for an infant, first, make sure the crib is at an appropriate working height or use a step stool. Lower the crib side rail closest to you, place them on a firm, flat surface, and obtain a CPR board like we have here. Or you can use a CPR-ready crib or bed. If you're not at the infant's bedside, use a stable surface above the ground, such as a table or a countertop, because it's usually easier to perform compressions from a standing position rather than kneeling at the infant's side.
Now that we know the basics of CPR, let's talk about some things that could go wrong. One of the most common issues people encounter when doing CPR is that the chest does not rise when they try to give breaths. There are typically three reasons why the person's chest may not rise when you give rescue breaths. The airway was not opened properly, the person's nose and mouth were not properly sealed, or an object is blocking the airway. If the first rescue breath does not cause the chest to rise, re-tilt the head to ensure that the airway is properly open and ensure that the person's nose and mouth are properly sealed before giving the second rescue breath. If the second rescue breath does not make the chest rise, an object may be blocking the person's airway. Never attempt more than 2 rescue breaths between sets of compressions. Immediately begin the next set of chest compressions. The chest compressions may force the object out of the person's airway. After this set of compressions and before giving rescue breaths, open the person's mouth. Look for an object in the mouth, and if you see it, remove it. To remove an object that you see in the person's mouth, do a finger sweep using your index finger for an adult or your little finger for a child or infant. Now let's watch a video demonstration of what to do if the breaths do not cause the chest to rise.
When giving breaths, the chest should rise. However, you might encounter a situation where the chest does not rise. If the chest does not rise on the first breath, reopen the airway.
Now that we have learned quality CPR, we are ready for the third step in the cardiac chain of survival, early defibrillation. In this video, we are going to learn how to use an AED. AED stands for Automated External Defibrillator. Defibrillation simply means to stop the fibrillating or abnormal pulses of the heart by shocking it. An AED, when used correctly, will analyze a person's heart rhythm, then provide a shock if needed.
When a person is in cardiac arrest, use of an AED can help restore a normal heartbeat. If you are the only trained responder on the scene, turn on the AED as soon as it is available and follow the voice prompts. Once the AED is turned on, remove all clothing covering the chest and wipe the chest dry if necessary.
Attach pads firmly to person's chest as shown.
Using the appropriate sized pads, place one pad on the upper right side of the chest and the other on the lower left side of the chest below the armpit. Remember, you should not use the pediatric AED pads or key on anyone older than 8 years or weighing more than 55 pounds. However, adult AED pads can be used on a child if pediatric AED pads are not available. If the pads touch, which is usually the case with small children and infants, place one pad in the middle of the chest and the other pad on the back, between the shoulder blades. Plug the pad connector cable into the AED if necessary and prepare to let the AED analyze the heart's rhythm. Make sure no one, including you, is touching the person. Say, "Clear," in a loud, commanding voice. Be ready to deliver a shock if the AED determines one is needed. To do this, make sure no one, including you, is touching the person. Again, say, "Clear," in a loud, commanding voice. Push the shock button to deliver the shock.
Shock delivered.
After the AED delivers the shock, or if no shock is advised, immediately begin CPR starting with compressions. Continue giving CPR and following the AED's prompts until you see an obvious sign of life or EMS personnel arrive. If there are 2 or more responders, the steps will be slightly different. Responder 1 will continue CPR, while Responder 2 sets up the AED. When the AED prompts, analyzing heart rhythm, Responder 2 says, "Clear." Then the responders switch roles. Responder 1 will now operate the AED, and Responder 2 will now provide CPR. The responder should switch roles in this manner each time the AED analyzes the heart rhythm.
Shock delivered. Begin 5 cycles.
Notice how CPR and AED use are working together as parts of the cardiac chain of survival. When CPR is not interrupted to prepare the AED, chances of survival are increased.
Remember, don't touch the patient when analyzing or shocking, and don't let the pads touch. Choking occurs when the airway becomes either partially or completely blocked by a foreign object. For example, a piece of food, a small toy, or bodily fluids such as vomit or blood. What are some risk factors for choking? Eating while talking or laughing, or eating too fast. Medical conditions such as neurological or muscular disorders that affect the person's ability to chew and swallow, or dental problems with poorly fitting dentures that affect the person's ability to chew food properly. Choking is a common cause of injury and death in children younger than 5 years. Very young children explore by putting things in their mouth, which increases their risk for choking. Children younger than 4 years often lack the skills needed to chew certain types of foods thoroughly. What foods and objects can be choking hazards for children younger than 4? Small foods such as nuts, seeds, and popcorn. Round, firm foods such as hot dogs, grapes, and hard candies. Sticky foods such as peanut butter, chewing gum, and gummy candies. Large foods that break easily into small pieces such as teething biscuits and cookies. Chunked foods such as fruit, raw vegetables, and meat or cheese. Small round objects such as coins, buttons, button batteries, magnets, beads, and vitamins. Small metal or plastic items such as toys, jewelry, safety pins, pen or marker caps, and the pull tabs from soda cans. Plastic bags and deflated or broken balloons, or baby powder.
Can I help
After
you?
confirming that the person is choking and obtaining consent, give a combination of 5 back blows and 5 abdominal thrusts. First, position yourself to the side and slightly behind the person. Bend the person at the waist so that his upper body is as parallel to the ground as possible. Firmly strike the person between the shoulder blades with the heel of your hand. Give 5 back blows. After the 5th back blow, reposition yourself to stand with one foot in front of the other, placing your front foot in between the person's feet to provide balance and stability. Find his navel with 2 fingers from one hand. With your other hand, make a fist and place the thumb side against the person's stomach, right above your fingers. Cover the fist with your other hand. Give 5 abdominal thrusts, pulling inward and upward. Continue giving sets of 5 back blows and 5 abdominal thrusts until the object is forced out and the person can cough forcefully, speak, or breathe. Or, if the person becomes unresponsive, send someone to call 911 if it has not already been done. Carefully lower the person to a firm, flat surface and immediately begin CPR, starting with compressions if you are trained. For a child, you might need to kneel in order to give effective back blows and abdominal thrusts. After confirming that the infant is choking and obtaining consent, give a combination of 5 back blows and 5 chest thrusts. First, place your forearm along the infant's back, cradling the back of her head with your hand. Place your other forearm along the infant's front, supporting her jaw with your thumb and fingers. Do not cover the infant's mouth. Turn the infant over and lower her onto your thigh so she is face down with her head lower than her chest. Give 5 back blows. Firmly strike the infant between the shoulder blades with the heel of your hand. Then, reposition the infant. Place one hand along the infant's back, cradling the back of the infant's head with your hand. Next, turn her over so she is face up with her head lower than her chest. Give 5 chest thrusts. Place 2 fingers in the center of the infant's chest, just below the nipple line. Press down about 1.5 inches, then let the chest return to its normal position. Continue giving sets of 5 back blows and 5 chest thrusts until the object is forced out and the infant can cough forcefully, cry, or breathe, or until she becomes unresponsive.
This is the end of the virtual CPR training video. Please make sure you have scheduled your in-person, hands-on training and written tests with Jordan Hines, the Director of Nursing. Her email or phone number can be located on the screen. Thank you. Have a great day.